Welcome to our channel. Today we're diving into a fascinating and often overlooked drug called seavalam. Can a drug that doesn't even enter your bloodstream still have a powerful effect on the cholesterol and blood sugar? Let us find out how this gut-only wonder works and why it's changing the game in lipid and diabetes management. Colesevelam is an oral bile sequestrant primarily used to reduce lower density lipids like cholesterol and control blood glucose levels in patients with type 2 diabetes. It binds bile acid in the intestine and prevents their reabsorption, helping the body get rid of cholesterol naturally. Structurally, it is a large, non-absorbed polymeric compound designed to stay in the gut. Its structure is hydrophilic, highly cross-linked, and resistant to digestion, which allows it to trap bile acids effectively without being absorbed in the bloodstream. If we take a look at the historical background, it was developed in the late 90s to provide a safer, better tolerated alternative to older bile acid sequestrants like cholestyramine, and approved by the United States in the 2000s. It marked a breakthrough by offering lipid-lowering effects with fewer side effects. Pharmacokinetically, Colesevelam is quite unique. It's not absorbed in the bloodstream nor metabolized and has no systemic distribution. It acts locally in the intestinal lumen, binds bile acids, and is finally excreted unchanged in the feces.
Meet Colesevelam, a medicine with brains and multitasking skills. Imagine it like a super clingy friend that grabs onto bile acids in your intestine and refuses to let go. This stops bile from being reabsorbed, so your liver goes, "Oh no, let's make more bile acids." And to do that, it uses up bad cholesterol LDL from your blood. Boom, cholesterol levels drop. But wait, there's more. Colesevelam doesn't just chill with bile acids, it also lowers blood sugar in type 2 diabetes patients. Now, when do doctors use this multitasking genius? For high LDL cholesterol, that's hyperlipidemia. For type 2 diabetes, as a sidekick to diet and exercise. For inherited cholesterol problems, familial hypercholesterolemia. And when statins say no thanks, Colesevelam says, "I got you, bro." So yes, it's a dual-purpose legend, cholesterol, sugar. It tackles both and doesn't even break a sweat.
Now let's talk about the contraindication of Colesevelam. There are 4 main conditions where the use of Colesevelam is not recommended. First, in a patient with a history of bowel obstruction. This is because Colesevelam can cause further slowdown bowel movements which can worsen the obstruction. Second, when the serum triglyceride levels are above 500 mg per deciliter, using Colesevelam in such cases can increase the risk of pancreatitis. Third, if the patient has a history of pancreatitis caused by hypertriglyceridemia, Colesevelam may worsen this condition due to its effect on lipid metabolism. And finally, if the patient is hypersensitive or allergic to Colesevelam or any of its components, in such cases an alternative medicine should be considered to avoid allergic reactions. Now let's talk about the dose administration of Colesevelam. For adults with hyperlipidemia, the usual dose is either 3.75 grams once daily or 1.875 grams twice daily, taken with meals. In adults with type 2 diabetes, the dose is 3.75 grams once daily, used as an add-on to diet, exercise, and possibly other anti-diabetic drugs. It is available in both tablet and suspension forms and should always be taken with meals and plenty of water to ensure proper absorption.
Now we will discuss how Colesevelam interact with other drugs. Colesevelam can affect the working of many oral medications by reducing their absorption by binding them in the gut. The drugs include like warfarin, phenytoin, levothyroxine, contraceptives, and some diabetic medications like extended release metformin. To avoid this, it's best to take other medications at least 4 hours before Colesevelam. Also, it can raise triglyceride levels, so caution is needed when using it with drugs that do the same, like retinoids or estrogen therapies. Now moving towards the adverse effects, it may cause gastrointestinal issues like constipation, bloating, dyspepsia, nausea, or flatulence. Or it may cause some metabolic issues like increased triglyceride levels, especially in patients with pre-existing hypertriglyceridemia. Or it may cause some other effects like headache, fatigue, muscle aches that may be rare.
Now we will discuss toxicity and overdose. Generally, low systemic toxicity due to no absorption. Overdose is rare, but possibly effects include severe constipation, bowel obstruction, especially in elderly or those with GI disorders, abdominal pain or bloating, nausea or vomiting, may worsen hypertriglyceridemia leading to pancreatitis in rare cases. Now we will discuss the brand names of Colesevelam, Velcol and Colesterol. The Velcol is most commonly known by Delici Sankyo USA and Colesterol used in the UK and parts of Europe. Here's the end of this video. Keep watching, keep smiling and keep exploring.